Good evening from Washington State, everyone. This is Quan Tran, and my student ID is L331707 and 64. Today, I will present my public health practicum. My practicum to improve the water quality monitoring program at Joint Bay Lewis McCall, Washington. My preceptor for this project is Lieutenant Commander Moeller, U.S. Public Health Service. He is the Chief of Environmental Health Service at Madigan Army Medical Center, MEMC. In this slide, we will discuss about the public health issue and challenge which EHS is facing daily. As you know, Joy Bay Lewis McCall or JBLM is the largest military installation on the West Coast. This base is supporting over 300,000 people, including active military personnel, family members, civilians, reservists, National Guard members, retirees, and contractors. Because JBLM is such a large installation, the water distribution system is very complex so that it can cover entire base. Meanwhile, EHS is limited staff who are responsible for not only water quality but also other public health services. Moreover, EHS is also responsible for Yakima Training Center. Recently, many studies has used ArcGIS Pro for spatial analysis on the large scale. This software can provide maps which can identify the trends, hotspots, or clusters. With the combination of inverse distance weighted IDW interpolation, we can predict the water quality at unsampled locations. Therefore, the objectives for this practicum are: first, we will review the current water quality monitoring program. Second, we apply ArcGIS Pro so that we can draw maps of water quality based on selected parameters. After carefully review and assess the water quality throughout JBLM, this practicum will provide recommendations for stakeholders to improve water quality management at JBLM to protect the health of people living and working at over here. In this slide, we will discuss about methods and settings used in this practicum. During this practicum, we only focused on drinking water provided by the water distribution system across JBLM. Therefore, recreational water such as lake or pool were excluded from this project due to they are subject on the different standard. The main hospital, MEMC, is also excluded from this project because the hospital is under a different and more stringent program. The main platform for this project is ArcGIS Pro software. We focus on 6 parameters as mentioned in this slide: pH, free chlorine, total coliform including E. coli, conductivity, total dissolved solid, and turbidity. The historical data since 2025 to June 2026 were provided by EHS. As we can see in this procedure diagram, the sampling location were verified by using Google Earth and Fieldworks. After obtaining latitude and longitude of all sampling locations, a raw sampling map was generated. From that, we refine our data based on exclusion criteria for the next step. After data cleaning, we use ArcGIS Pro software version 3.7.1 together with the water utility line shapefile. and the IDW interpolation to create data visualization. Krabs and George conduct spatial analysis for 6 parameters. You can see the spatial map of each parameter in the next following slide. In this slide, we can see the interpolation of both conductivity and total dissolved solids, TDS. We can see that both spatial maps reflect the same pattern for these 2 parameters, which are area have high TDS, will have high conductivity. For instance, the area around both airfield has higher conductivity and TDS, the red circle. Even though this area has elevated TDS, the interpolation still estimates TDS across JBLM under the EPA threshold of 500 mg per liter as secondary standard for drinking. In this slide, we will see the spatial map of pH and turbidity. As we can see that the red circle are the area where the water is slightly lower pH, while the blue circle are the areas where the water is a little bit higher pH. However, field test results are all within 6.5 to 8.5 pH range recommended by the TBMed 576. The interpolation also predicted pH across JBLM within this range. The map on the right is the interpolation of turbidity. The green dots are sampling location, indicating most of the field tests were low turbidity. Despite that, the IDW interpolation still predicts some elevated turbidity at certain areas as Fort Lewis North. This may be the indication for stakeholders to pay more attention for water quality management. Over here, we will discuss about free available chlorine and bacteria tests. Although the IDW interpolation predicts some area with lower free available chlorine, the red circle, the estimation still indicates that the free available chlorine throughout JBLM is well above the minimum level of 0.2 mg per liter recommended by TBMed 576. You can see the green dot allocation negative for both total coliform and E. coli. Notably, there are locations positive for total coliform, with one of them positive for both total coliform and E. coli, like here and here. You can see that these locations are in a lower free available chlorine zone. However, when we investigate further into that specific day, the field test confirmed that the free available chlorine were well above 0.2 mg per liter. Therefore, the reason for positive results at these locations remain unknown. We can see that the application of ArcGIS Pro to improve the water quality monitoring program is achievable. This software is a powerful tool with many built-in analysis capability. From spatial mapping, we have a better understanding of water quality across JBLM. For instance, IDW interpolation predicts Fort Lewis North as a potential hotspot for water compromise. Therefore, EHS should pay more attention to this area in order to ensure adequate water quality at this sector. Although this project did not propose a new sampling plan, it creates a good foundation to improve water quality monitoring. The spatial maps are provided to EHS chief for further validation so that they can improve their sampling plan in the calendar year 2027. Moreover, the application of ArcGIS Pro can extend beyond water quality monitoring. It can be applied to wastewater biosurveillance, entomological survey, or food sanitation inspection. However, this project also has several limitations. First, this project did not assess seasonal variation of water quality. Ignoring seasonal changes of water may lead to incomplete assessment of water quality and its implication for public health. Second, this project did not account the holistic water quality index. A comprehensive water quality index would provide a more integrated view, avoid confusion, and better communication for residents and stakeholders. And lastly, although just ArcGIS Pro is a potential solution to improve water quality program, it requires much technical knowledge. Because of that reason, I could not use ArcGIS Pro at its max capability, so I can have a better assessment for EHS chief during this practicum. In conclusion, the IDW interpolation estimate water quality across JBLM meet TBMET 576 standard. Geospatial visualization from ArcGIS Pro can help us to identify hotspots so that we can prioritize our resources and personnel. Although I was able to conduct spatial mapping, EHS needs to validate this methodology further so that the chief can make a data-driven decision to improve the water sampling plan in calendar year 2027. And lastly, ArcGIS Pro application can extend to other public health missions. That concludes my presentation. I would like to express my special appreciation to Lieutenant Commander Moeller for his guidance and the opportunity. I would like to say thanks to Dr. Kraft for her instruction during the last 14 weeks. Thank you very much.